Hi, everybody. Welcome. We're going to get started in just a minute. Q&A is open, so feel free to hop on in there, say hi, let me know where you're from. And just a reminder, today is Wednesday, and Wednesday is double feature day. We're going to be back here in about 2 hours talking about dissociative identity disorder. So if you haven't registered for that, we'll put the link in the chat to do so. So hop on into the Q&A, let me know where you're from. Let me know if you've already registered for our Wednesday double feature. Tell me all about it. Okay. California's here, Pennsylvania, 3 Pennsylvanias in a row, Alaska, North Carolina, UK, West Cork, Ireland, Nashville, Tennessee is here, New York, Missoula, Montana, London, Vancouver Island, Arizona, Council Bluffs, Iowa is here, Maryland, some more Iowa, Bakersfield, California, Minnesota, Vancouver, Mid-Missouri is already registered for double feature. Just a reminder, Wednesdays, double feature day. We'll be back in about 2 hours, and we're going to talk about dissociative identity disorder. Lebanon, Pennsylvania, Philippines, New York is registered, Iowa's here, Philadelphia, Tallahassee's registered, Louisiana, Ontario, Texas, Canada, Kansas, middle of Tennessee registered, awesome, North Carolina, Pleasantville, Iowa's here, Cairo, Michigan, Washington is here. Laredo, Texas, Southwest Virginia, Minnesota, Alabama, Scotland, Macedonia, Massachusetts, Las Vegas, Indiana, California, Texas is registered for both. Pace, Florida, is that how you say that? Pace, P-A-C-E. South Carolina's here, Florida, Sarasota, Northwest Ontario, Midland, Michigan is here. Florida's here. Saginaw, Michigan. Got a lot of Michigans today as well. Philadelphia, Minnesota, St. Louis is here for the double feature. Saskatchewan, Iowa. Oh, we got people that are just signing up for the double feature. That is awesome. So for anyone that is just joining us, welcome. We're going to get started just another minute or two. Right now we're in the Q&A sharing where we're from, and we're also talking about Wednesdays being double feature day. So if you did not know, or maybe you just forgot, on Wednesdays we have double features. And so the next one starts just about 2 hours, so about an hour after our first one ends. And we'll be talking about dissociative identity disorder, which was previously known as multiple personality disorder. So if you haven't registered, we put the link to register in the chat for you. And you can go ahead and register for that because, you know, I love chatting, and getting to chat with you twice in one day is such a treat for me. I love it so much. All right. Hearst, Ohio is here, Oklahoma, London, New Mexico, United Kingdom, Eastern Pennsylvania, San Antonio, Texas, England. All right, we got lots of people registered for both. If you're not sure if you're registered, go ahead and register again and it'll let you know. Grand Rapids, Michigan's here, Puerto Rico, Illinois, Edmonton, Alberta. It is Jessica's 51st birthday. Happy birthday. Thanks for spending your birthday with us. Iowa is here, California, Philadelphia. Oh, someone is saying they like the Little Caesars puffs. All right, I went on a bit of a rant last Wednesday, and I'll bring it up again. The Little Caesars puffs. I'm not a big fan of Little Caesars regular pizza, but the puffs, oh my gosh, they're amazing. Thank you Eric, now I'm hungry for some Little Caesars puffs. They're the best though. If you haven't tried them, you got to try them. And if you haven't tried them and you try them because of my review, please let me know what you think. Maryland's here, Ontario, Northwest Indiana, UK is signed up for both, Texas, Florida's ready for that double feature, Poconos is here. Modesto, California, Nova Scotia, Dudley, UK, am I saying that right? Davenport, Florida's here, Minnesota, Wisconsin, Wichita Falls, Texas is here. Iowa again, we got lots of Iowa today. Tri-Cities, Washington is here. Bakersfield, California. West Bank, some more Iowa, Leeds, St. Louis is here. Ontario, Ireland, Greenville, South Carolina via Ireland. Davenport, Iowa's here. New Jersey. All right, we got people that are just registering right now for that double feature. So you can go ahead and do that. Just one last reminder. Well, it won't be my last reminder because I love to remind you because I love everyone to be here with me. Today is Wednesday. Wednesday is double feature day. We will be coming back in about 2 hours, so about an hour after this webinar ends, and we're going to talk about dissociative identity disorder, which used to be called or better known as multiple personality disorder. So if you're ready to join me and learn about that, make sure you're registered. We'll put the link in the chat to go ahead and register. So if you aren't registered, go ahead and do that and then let me know in the Q&A that you have gotten registered because I love to be able to see all of you twice in one day. Massachusetts is here, Maine, Vancouver, South Africa, New York, some more Iowa, Ohio, Ontario, New Jersey, New York, some more Iowa, UK, Pittsburgh, Iowa again. UK's here, South Africa, Ontario, Pennsylvania, Iowa, Texas. All right, looks like lots of people are getting registered. We still got time. Okay, Idaho is here. All right, looks like lots of people are getting registered. So good. While you're finishing that up, it's probably a good time for us to get started. You know how I love for us to stay on time so we can finish on time and then we can get the second webinar started on time. So let's get started. Today we're going to be talking about understanding family reactions to mental illness, and this is brought to you by Mindspring Mental Health Alliance with special thanks to Polk County, Iowa for partnering with us and sponsoring today's webinar. So everyone's mics are muted, your cameras are off, Q&A feature is on. So if you have questions, hop on into that Q&A, send them over to me. I'll check questions as we go through each section. If you ask a question that I know I'll be able to answer through a future slide, I'm going to hold off until we get there. And then I'm going to save a little time at the end for questions and answers. Now, we do have about 500 people joining us right now. Usually in the next couple of minutes, we get a few more. And I bring that up as to why I might not be able to answer all of your questions. So please don't be offended or take it personally if I can't get to your question. We simply just ran out of time. Now, we do offer closed captioning. Go to the bottom of your screen and look for that CC button. Give it a click and that'll turn captions on. Click it again and it'll turn them off. And then for anyone that is new, my name is Jamie. I am a licensed master social worker. And when I'm not here doing these webinars with all of you, I am a therapist. I work with both adults and adolescents. Prior to that, worked heavily in child welfare, working with kids and teens that had experienced some abuse or neglect, many of them being part of the foster care and adoption system. Now let's go over our frequently asked questions. This is being recorded and everyone who registered for today's link in it. Also in that email will be all of the resources we talked about today. No slides will be sent out. And we do offer certificates of attendance. So everyone who registered for today's webinar and joined the live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. Complete the webinar follow-up survey that's linked in that email to receive your certificate. Certificates aren't available for anyone who's only watching the recorded version of the webinar later on. And CEUs are not provided for community education webinars. All right, so what are we going to learn about today? So first, we're going to talk about some common challenges when we're talking about families and mental illness. We'll go over some of the factors that impact how a family responds. We'll go over some of the stages of the emotional response, as well as the stages of the caregiving experience. We'll talk about coping with stress and practicing self-care. And then at the end, we'll talk about responding to some of the more difficult behaviors. But first, I want to go over this help wanted. We're looking for some help, a person willing to work all hours of the day, 7 days a week, no PTO or sick days or holidays off. There's no salary, no bonus plan or 401k. There's no supervisor, there's no job training, no, annual holiday party. Now, for this job, you must be emotionally involved with the person you're going to work for and be willing to work until you're exhausted. You must be a self-starter and an entrepreneur. You must be willing to learn the job by trial and error. The person that you're going to be caring for will frequently not be able to express any kind of appreciation to you and might even be rude or even abusive towards you at times. So I'd love to know, is anyone interested in this job? Apply immediately, right? And so I'm gonna, real quick, before we kind of jump into everything, I'm gonna open up the chat. How many of you, whether it's paid or volunteer or for a family member, are doing this job already? Where you are that caregiver. And I know we said unpaid, but sometimes we're a caregiver in a paid situation. But hop in the chat and let me know, how many of you are working this job already where 24 hours a day, 7 days a week, you are doing this and it's not being appreciated, and maybe once in a while appreciated. But yeah, share in the chat, because I think being a caregiver in whatever capacity oftentimes feels so lonely, and knowing that you aren't alone, right? That you're here with probably 500 other people that are feeling that same way. Just so you know, right? You're not alone. And I'm looking at the chat and there's our proof. So people are sharing with their kids, with their parents, with their in-laws. Some people are doing this as a paid job, but very rarely does a caregiving position actually pay what it is worth, right? So maybe in this part where it's like no salary or bonus or 401k, maybe that's a little bit different, but very rarely is it being properly compensated for those of you that are paid. All right, thanks so much for sharing in the chat. And so now you just know you're not alone, right? You're not the only ones that are feeling this way. So let's talk more about this and what we can do. Right, so I already did this poll, right? How many of you are doing this job every day? And based on the chat, lots of you. So there are unique challenges, right? Every family experiences challenges from time to time, of course, but families with one or more family member that's living with a mental illness faces some unique challenges. Things like instability or unpredictability. Maybe there's some role confusion. So maybe you're the adult child, but you're having to care for parents like their children. Stigma that's involved with mental illness in general, having a family member with a mental illness. Maybe you're noticing there's a lack of support. Maybe friends and family, it seems like they've disappeared now that things have gotten hard. And that can leave you feeling pretty isolated. Then there's emotional challenges, right? There's a lot of different emotions that come along with being a caregiver. Sometimes we feel guilt. Oftentimes we feel guilt about the anger or resentment or shame or embarrassment that we feel, right? We feel guilty that we're having these difficult emotions. But there's nothing wrong with it, right? You're not abnormal. It's very common to feel all of these things. You might feel helpless or exhausted, depressed. You might be fearful, maybe of inheriting a family member's mental illness, might be fearful of rejection from others. including friends or romantic partners. This could be rejection from coworkers, from neighbors, from people within maybe a religious community or within extended family. And so it's not abnormal to feel ashamed, hurt, or embarrassed by a family member whose behaviors can be difficult to understand and deal with. Now, many people also feel anger just at the circumstances as a whole. Parents often have to readjust maybe their hopes and their expectations of the future when their child develops some serious mental illness. In the process, they may grieve for the future they thought the child would have. And though it might not be logical, parents often engage in some kind of degree of self-blame. Feelings of shame and anger may also go hand in hand with feelings of guilt. And so we might see relationship challenges for everyone that's involved, right? So we may be struggling to balance our responsibilities, right? So we may be responsible to the person we're caring for, but everyone else in the family, we have responsibilities towards too, and that can be hard, especially if we are the parent and we've got children and one needs extra help and the other doesn't. It can be hard to balance those two responsibilities. Or setting boundaries. It can be difficulty balancing self-care and taking care of others. And we aren't setting the boundaries that are needed to be able to make sure we're making the time for us. So we're not only are we not establishing, but then we're not enforcing the healthy boundaries. So maybe we even try to establish them, and then we're not enforcing them. Might be some challenges with initiating and maintaining things like friendships and romantic relationships. And all of these things can, like I mentioned before, leave us feeling very isolated and alone. And then there's relationship challenges for parents and siblings. And I kind of touched on this just a minute ago, but devoting equal time. So if you have a child with a serious mental illness, you might find yourself really focusing your attention on that child and less on the other children that maybe don't have as many obvious or pressing needs, but of course they still have needs for love and affection and time. And so that can be really hard. It can be hard for the siblings themselves because sometimes they have to take on extra responsibilities. The healthy siblings might feel anxiety or frustration at the extra responsibilities that they're expected to take on. And there might be some challenges for spouses or partners. In romantic relationships involving a partner living with a serious mental illness, the situation can become even more complex. There might be additional responsibilities. Many times, a partner without a diagnosed disorder will assume more of the responsibilities in the home, at least for the short term. For a person who is already worried about what's happening with their partner, having to spend more time maintaining the household or care for children might be especially difficult. Oftentimes, too, it can be hard when we have to start caring for a spouse. It almost starts to feel like we're parenting them, and that can be difficult. It can make that relationship confusing. So what we really want to do here is have that clear, honest communication. And this is going to be really crucial for everyone that's involved. For example, we don't want to be afraid to ask both the ill and healthy family members, adults and children, how they feel about the changes that have occurred within the family. We want to keep a line of communication open, and this really helps to regulate emotions and is shown to improve outcomes for everyone, including the ill family member. Now, we might be seeing some behavior challenges that can be kind of difficult to cope with at times. We might see some angry outbursts. Person is maybe struggling to control their anger, their irritability. Might be some self-defeating thoughts, attitudes, or behaviors, right? Well, my needs just don't even matter. Or, it's no use even trying. And that can be really frustrating. Maybe we're equating achievement and self-worth. If I am perfect in school, at my job, in my relationships, I matter as a person. But if I fail at these things, I'm worthless and a bad person. And this isn't only with the ill person, right? This might be one of the siblings, or this could be you, right? If I'm perfect in these different areas or a perfect caregiver, then I matter, then I'm worthwhile. But if I'm failing at these things, right? And we can put failing in quotes. If I'm failing at these things, then I'm worthless. I'm a bad person, right? And that's just not accurate. So if you're experiencing you in the past, currently, any of these challenges, just know you're not alone. And we kind of had proof of that, right? We were in the chat and we had lots of you sharing that this is what you're experiencing right now. So you aren't alone. And it can be helpful to recognize that these feelings, behaviors, and relationship patterns may have helped you to manage challenging family dynamics, especially during childhood. Right. So starting to think, okay, maybe I had an ill family member when I was young. And did I learn some of these behavior challenges? We'll go back, right? Equating achievement and self-worth or self-defeating thoughts. Maybe I learned those as the healthy person when I was younger. And maybe these thoughts, behaviors, or family dynamics as a whole really kind of worked at the time to keep us safe. And now it's just not working anymore. Right? They could have been coping mechanisms. You know, unfortunately, those coping mechanisms, if they're not healthy, right, can have negative long-term consequences. So what we need to work on is identifying them and then making some adjustments. And so it's also important to recognize that these patterns of behavior might not be working as effectively as we enter new phases in our life, right? So we're recognizing that for whatever reason, it was helpful in the past and it might not be now. And so we want to consider the consequences of these feelings and behaviors, right? Recognizing that these challenges can limit our life choices as an adult. And this is an important step towards developing new and better ways of addressing problems and then relating to them. So we acknowledge the impact that our family members' mental illness is having on our life. It's normal, right, to feel feelings of anger and shame and guilt and all the other ones we've already listed today. It's natural to grieve the parental or family support that you didn't receive. And remember that you're not responsible for causing your family member's illness, and you're not responsible for, helping them, curing them, right? Whatever word you want to use. We can support, but we're not responsible for fixing this for them. Right, so let's do a summary real quick. Families with one or more family member living with a mental illness face that unique set of challenges, including role confusion, stigma, and isolation. Emotional behavior and relationship challenges are common, and it's normal to have feelings of anger, shame, or guilt. It can be difficult to have all of those feelings. We want to recognize that those are normal and common. It can be helpful to recognize that these feelings, behaviors, and relationship patterns may have helped you to manage and endure challenging family dynamics. And then it's important to recognize that these patterns of behavior may not be effective long term, might not be helping you any longer. And then we start to make those changes. All right, so next we're going to talk about impacting factors. Before we do that, let me just check a few questions from this last section. So someone asked, they feel like their mom might be in denial that their brother has a serious mental illness, so serious depression. What do we do if not everyone in the family is agreeing about what's happening? And that can be really difficult. That does happen. And so there's a variety of things that we can take into consideration. Now, in this case, right, if the brother is a minor child, there's not as much that we can do to help them, right? Because mom is the parent, the guardian in this situation. But we can talk with mom, we can give her some education, we can reach out to mental health professionals, people within the community that might be able to assist. Now, if you're an adult, brother's an adult, you might be able to go straight to this person and offer some assistance, right? Give them some support. And so we can kind of just bypass mom and go straight to the brother to be able to offer some support. So someone said, what if a person decides to stop their medication? Unless they are a danger to themselves or others and they've been court ordered to participate in treatment, people with a mental illness don't have to take medication. It's not a requirement. Now, the person said, well, what if, they start to change? Maybe they're more angry or they're more irritable for no reason. Well, the reason is most likely their symptoms of whatever it is that they've been diagnosed with are starting to come back, and that's why. But just because someone has a diagnosis doesn't mean that they're allowed to treat us however they want. And so it is about setting boundaries. And it's, noticing, what I noticed that, you have been more angry and irritable with me lately. Can you tell me more about that? What do you think is going on? And so we can start to have that conversation, and we're trying to be curious instead of confrontational or judgmental. But at a certain point, we can say, I've noticed that you've stopped your medication. Can you tell me why that is? They may have stopped because of side effects, because they don't like how it makes them feel. And you can help with that. Maybe there's something else that they could be taking, but it's setting those boundaries and letting them know, I can't participate in these conversations where you're angry and snapping at me. Right. So we're setting boundaries to keep ourselves feeling good and feeling safe. We can't control whether they take their medication or not. All right, so let's talk about those impacting factors. So there's a variety of factors that can impact how a family responds to mental illness, or we can also think of like a mental illness crisis. So the support system, right? Does a family have a large support system? It could be extended family, friends, neighbors, various organizations that they're part of, community organizations, those kinds of things. Or do they already feel pretty alone? And now there's this diagnosis that's making things harder. Previous experience or knowledge of mental illness. It can be much harder for a family to respond to a mental illness when they have no experience with it. It's never happened before. They don't know anyone that's experienced this. When we already have some experience, whether it's with us or with someone else, we kind of know a little bit more of what to expect and what to do next. So when we lack that experience, it can be more difficult. The coping mechanisms and resources a family has. Were we already coping well, or were we struggling with just typical stressors and not being able to cope? Access and the quality of healthcare. Do we have insurance? Do we live somewhere where we have access to the type of healthcare that our loved one needs? Or are we maybe in a more rural area that doesn't have this specialized treatment? Financial resources make a difference, right? If we have the money to maybe pay out of pocket for certain things, then that can make a big difference. If we don't have the finances and our insurance isn't covering it, right, we might have to make difficult choices. Or the type of onset of the illness. Did it happen suddenly, or were we seeing these behaviors gradually happen? Was it happening privately, or was there a sudden onset in public? What the nature of the symptoms are. Right? There are symptoms that are a little bit easier to handle than others. The person's compliance or refusal to participate in their care. Right? Having someone comply, recognize that they need help, and participate makes things so much easier than if they're refusing. And then, of course, the diagnosis and then the prognosis of the illness. That makes a difference in how we respond as well. So there's models that describe family reactions to mental illness, and we're going to talk about both of them. First, there's the predictable stages of emotional reactions, and then the stages of the caregiving experience. And so these models are helpful to explain and understand the emotional stages families go through when a loved one experiences a mental illness. Now, family members may repeat stages or get stuck in one particular stage. And each family member will respond differently to the situation, and members are often in different stages. So again, we don't go straight through all of the stages. Sometimes we get stuck somewhere. Sometimes we go backwards and then forwards again. And the family members do this at different rates. So first, the predictable stages of emotional reactions, and we'll talk about each of these individually. But first, it's the heads out of the sand. The family realizes that a loved one has a mental illness. Number 2 is learning to cope. Families grow in acceptance of the illness. And then 3, moving into advocacy. Families may support others who are struggling with similar challenges. So let's talk about those. First one, right? The family realizes that a loved one has a mental illness. So maybe we've been seeing some behaviors before, but we really weren't sure what's going on. And now we recognize what's happening. We might be feeling like we're in crisis, or our loved one that's ill might be in a crisis. We may be shocked that this is what's been going on. Might be feeling some denial. Might be really hoping, right? Maybe this isn't the case. Let's just keep hoping. Maybe this will get better. And so people that are in this stage really need support from their outside support system and comfort, right? From that support system. They need some empathy for how confused they're feeling. And this can come again from that support system, but also from the professionals that they're working with, and empathy for their pain. They're going to need help finding resources. This is oftentimes a space for early intervention where we can get the ill person help early on. And knowing the prognosis of the diagnosis is going to be really beneficial as well. Then in the second stage, we're learning to cope, right? The family is growing in acceptance of the illness. Their emotions intensify, anger, guilt, resentment. There's more recognition of what's going on. But now that we're accepting it, we might also be feeling grief for the things that may not happen in the future that we thought would. And so families in this stage need to be able to vent their feelings and still remain hopeful, though. Just because the future may not look how we expected doesn't mean that we can't be hopeful for a positive future. Education, so additional education can be really helpful in this area. And then being encouraged and taught how to do self-care, how to take care of ourselves. Sometimes we get in this space where we're caring for someone else and we just forget about ourselves. Networking with other people that have experienced this or something similar can be a great part of this step. And then cooperating with, I guess we can call the system, right? Cooperating with treatment plans and kind of figuring out how we can all work together to get the best care for our loved one. And then there's moving into the advocacy. Some families move into advocacy roles as part of their emotional response. Their understanding and acceptance of mental illness has grown, and they may support other families who are struggling with similar issues. Right? So in this stage, we're going to be more of an understanding and acceptance of what's going on, and then possibly choosing to take action, and whether it's advocating for laws or changes in how mental health and mental illness is treated in the country, or helping other people going through it. This can be a part of that stage. And so families in this stage, though, need to make sure they're maintaining a healthy balance of their own lives, right? They have to be prioritizing themselves first before helping others. And assurance from professionals that the mental health system will continue to be responsive to the needs of their ill family member is going to be a really important piece of this as well. Now let's talk about the stages of the caregiving experience. So first, this is the emotional anomie. This is the stage that comes before the firm diagnosis. Then we're going to have some hope and compassion, and this occurs when the diagnosis is provided. Next, we might have a loss of dreams and resentment. Now the family is understanding that the illness may be permanent. And then acceptance. The family realizes that it can't control their loved one's illness. So this is before the firm diagnosis, and this includes a variety of feelings. In this stage, the expectation of how someone will behave really is no longer met. The person is acting differently, and it's unclear why. A wide variety of feelings can come in this stage. So it could be the fear and confusion about the ill person's behavior. uncertainty about how we feel about what's even going on, disorientation during the chaos of the situation, especially if we're in crisis, questioning, maybe what did I do wrong as a parent, as a partner or spouse, as a child to cause this illness, when in reality, that's not the case, right? And then hope, that the behavior is just going to go away. Maybe it's just a midlife crisis. Maybe it's just teenage rebellion. Next comes the hope and compassion. And this is really around the time of getting the diagnosis. The diagnosis can clarify much of the confusion that we're experiencing in stage 1 and can prompt maybe some more optimism and sympathy in families. And so this stage is going to involve a lot of learning and maybe studying about the illness. It still involves hope that a combination of medication, therapy, family love is just going to provide a rapid cure, right? So we're still hopeful that this might just go away. There might be some heroic measures to cure the person. We're looking up miracle drugs. We're thinking about flying to other countries to try different studies, right? So those big measures to try to cure the person. And oftentimes this is the space where family members start to embrace a caregiving role. They're starting to understand that I might have to be a caregiver, at least for a short time, but possibly for a long time. And it can be very reassuring, for both the individual and the families, once a diagnosis is made, right? A diagnosis can clarify how long to expect these symptoms, and it can clarify the history of some confusing behaviors. Then we can experience a loss of dreams and some resentment, as the family realizes the illness is likely a permanent condition. So during this stage, families are going to experience maybe some anger and resentment. They feel powerless to change the situation. They adjust their expectations for the ill family member. Maybe some role reversal, kind of talked about this already before. An example would be a child having to take care of an ill parent, or maybe a spouse having to care for their partner like they're a child. Experiencing resentment when they have to give up their own goals and activities to help this loved one. Becoming isolated from support network because of the demands of dealing with the illness, and wondering about their loved one's ability to control their behavior and struggle with how to interpret the behavior that is being exhibited. So then we have the recognition, right, that families can't control their loved one's illness. And this is followed by acceptance. Right? As families move into this acceptance phase, they can feel relieved of a sense of responsibility to fix the problem. And it can be important to accept the 4 C's. I did not cause it. I cannot control it. I cannot cure it. All I can do is cope with it. And I'll say that again. I did not cause it. I cannot control it. I cannot cure it. All I can do is cope with it. So it's cause, control, cure, cope. And in this space as well, we can gain respect and admiration for our loved one's struggle and their strength to get through this difficult time. So let's summarize all of that. There's a wide range of emotional responses among family members, and several factors will impact how a person responds to changes in their loved one's health. Models are helpful to explain and understand the emotional process families experience, but they're not intended to describe a linear progression, so one after another. Often people repeat stages and can get stuck in one for a little while. Coping with a loved one's poor health, physical or mental, is difficult, and regardless of the nature of that illness, and each family member will respond differently to the situation, and members are often in different stages. All right, so next we're going to talk about coping with stress and then practicing self-care. Before we do that, let me just check a few questions from this last section. Can peer support be helpful for both the person experiencing the mental illness and the family? Absolutely. So there are support groups, peer support groups, specifically for someone who is experiencing a mental illness, and sometimes they're very specific to the actual illness. And then there are family support groups. So you're there with your peers, other family members of someone who has a mental illness. And this can provide an enormous amount of support, right? You're able to talk with someone that really gets what you're experiencing. They also oftentimes are a wealth of knowledge and resources. How do we handle no prognosis? Right? That can be hard, right? We know something's going on, and not knowing what the diagnosis is. And that can be hard, right? That can be a big barrier to be able to move forward. And so what can be beneficial is seeking out treatment for yourself, right? We don't have to be the one with the diagnosis to be able to go to therapy, to talk with someone, to be able to feel differently about what's going on. And so we can seek out our own treatment so we can start to handle all of these unknowns a little bit better, learn more coping skills for them. So someone said that oftentimes, seeing a psychiatrist, a therapist, getting a diagnosis, and then maybe seeing someone else, sometimes there are different diagnoses, and this is frustrating. Why does this happen? It could be a variety of reasons, right? Misdiagnoses do happen sometimes. It is hard to diagnose mental illness for a variety of reasons. Main one being there's no blood test or scan or x-ray that we can do that that just automatically tells us what the diagnosis is. Two, research is very behind when it comes to mental illness, and part of that being simply because it's hard to research the brain. Another reason is that a lot of the diagnosis is based on self-report. So we go see a psychiatrist, we go see a therapist, we talk about the symptoms that we're experiencing, and they make a diagnosis based on what we're sharing. But if we're sharing inaccurately, now it could be purposeful. Most of the time it's not. Oftentimes we don't know that certain symptoms are an important piece of it. Right? I might know that I'm sad and struggling to get out of bed, but I don't know that I need to share maybe how happy I am sometimes, or how irritable I am, or those kinds of things. And if we're not sharing all the information, and again, it doesn't have to be purposeful, that can result in an inaccurate diagnosis as well. All right, so now let's talk about coping with stress and then practicing self-care. So we want to prioritize that self-care. We're recognizing that we are managing significant life stressors and that self-care is going to be a necessity. It's not a luxury, right? This isn't something that we earn later. This is something we must do. So don't forget about yourself because you're busy caring for someone else. So set aside time for yourself each day, even if it's just a few minutes. And remember that your loved one deserves the best version of yourself, well rested, renewed, refreshed. And then make your health a priority. Take care of yourself. We're eating healthy foods. We're being physically active every single day. We're getting enough rest, 7 to 9 hours each night. And I get that it can be challenging to prioritize ourself and our physical health, but it's really critical to do so to avoid problems later on. Oftentimes we think, well, I can't put myself first. I've got to care for this person, but there will come a time when not caring for yourself catches up with you. And now not only are you sick, but you're not able to help your loved one. Another piece of this is getting outside, get some sunshine, be outdoors. This can be a really powerful tool in fighting any kind of symptoms of depression and anxiety within yourself. Make sure you're talking about things. Open communication and problem solving is really just as important as eating well and getting enough exercise and sleep. Having regular conversations can help a family work together to better understand and address the stressors that each family member is experiencing. We want to find someone that we trust. It could be a friend, a coworker, a neighbor, right, who can offer some non-judgmental emotional support. And set aside time every single week for connecting with this person. It can be very helpful to start accepting our own feelings. Having negative feelings, the frustration or anger or guilt or shame, right? All of those things about our responsibilities or the person that we're caring for really is normal. Right? This doesn't mean that you're a bad person or a bad caregiver. So accept those feelings and don't feel ashamed and don't shove them down. Want to get rid of trying to be that superhero, right? No one's perfect, so don't expect perfection from yourself or from other people. Ask yourself what really needs to be done. This could be in general, or maybe even on a day-to-day basis. How much can I actually do? Is the deadline I'm giving myself to accomplish all of these things realistic? And then really be honest with yourself. What adjustments do I need to make? Then set some realistic goals. We can prioritize, make lists, establish a daily routine. Staying organized with a regular routine and a to-do list can help to prioritize what needs to be done now and what can wait. Make sure you're also knowing your limits and being honest with yourself about your personal situation. Recognize and accept your potential for caregiver burnout. And make sure you're saying no to requests that are draining or unnecessary. You don't have to say yes to everything. You want to educate yourself about your family member's illness. Now, this doesn't mean that you need to know everything about this illness. That's not your job. Your job isn't to treat or cure your family member. Right? You want to familiarize yourself with the symptoms of the illness so that you're able to recognize with your, when your family member might be showing signs that the illness might not be so well controlled or could be getting worse. Right? But again, we don't have to know everything. Educating ourselves about the illness can help us to better understand what our family member is dealing with and how it's going to impact the family. It can also help you to manage the difficult feelings of guilt and anger, resentment, embarrassment, shame, and fear. And develop some new ways of relating to other people. Be mindful of old and maybe unhealthy patterns of communicating and practice new ways of relating to your family members. And this may include setting and enforcing, right? So it's important we have to do both. Set and enforce new boundaries. We can set boundaries, but if we don't enforce them, oftentimes they're just ignored. Also set some personal limits. As relationship dynamics shift, enjoy and appreciate stability in your relationships and recognize that relationships don't have to be defined by crisis or dependency. And you can join a family support group. I kind of touched on this already, but if an in-person support group aren't available in your community, there's several that are online. We have Mental Health America, Family Caregiver Alliance, and we'll make sure you get these links. The support group can help to reduce feelings of isolation and validate your experience. Family support groups can be particularly helpful in cases when other family members are either uncomfortable with or don't acknowledge the problem. And then, like I already mentioned, consider seeing a mental health professional yourself. Caring for someone that has a mental illness can increase your own risk of both mental and physical health complications. And it's really important to know your limits and to look after yourself. So a mental health professional can help you to understand the impact a family member's illness has had on your life. It can help you to process your emotions and identify your needs. A mental health professional can also help you to learn and develop healthier ways of caring for yourself, relating to others, and coping with challenges that you might be experiencing in relationships, and in managing and expressing your own emotions. You do not have to have a diagnosis yourself to see a professional. So when do we want to see one? And it can be at any time. But if you feel like you're worrying too much and it's interfering with your work, relationships, or other parts of your life. If the fear, the worry, the anxiety is upsetting you and it's difficult to control. If you're feeling depressed, you're struggling with alcohol or other drug use, or have other mental health concerns. Mental illnesses don't often go away on their own, and symptoms may get worse without care. Mental illness is easier to treat if you get care early on, right? So if you're starting to have these symptoms, make sure you're seeking out help too. So in summary, Caregiving roles are inherently stressful and carry a significant risk of burnout. Self-care is not a luxury, it's a priority. You have to put it first. Managing stress and preventing burnout, we want to prioritize our own health and happiness to avoid future problems. Find someone you trust who can provide non-judgmental emotional support. Set realistic goals and know your limits. Accept help, and support groups are available. And then lastly, we're going to talk about responding to behavior. Before we do that, let me just check a few questions from this last section. Someone asked, how do we know if we are okay if we've stopped taking our medication? And so we're really watching for symptoms. So knowing what our symptoms are, but also turning to our loved ones, right? Are there certain things that they may be noticing? Oftentimes our loved ones start to notice our symptoms of mental illness before we do. And someone asked if there's resources for siblings, and there are. These family support groups absolutely can be open to you if it's a sibling that is struggling with a mental illness. And then, of course, going to treatment, right? Having your own therapist to talk to can be a big part of that as well. And then let's talk about responding to these behaviors. So challenging behavior in a loved one is often the hardest part of mental illness for people to understand, accept, and cope with. There are lots of reasons why people do things. Not everything your loved one does is because of their illness. All situations and relationships are different, and what works for you might not work for someone else. So how do we respond to anxiety? We can keep our voice neutral. Try not to talk too fast or too loudly, speak clearly, and use simple sentences. We can ask them, right, to find out what's wrong and whether we can help. It may help to sit down during this conversation. And then we want to really listen when we're asking questions, right? Your loved one might find it helpful to talk through their concerns, especially with someone who wants to understand and wants to help them. And then provide some validation. Ask your loved one how you can provide support during challenging moments. And something else that can be really helpful not in the challenging moment, but in when we're outside of a challenging moment, asking, right? What can I do in these tough times that would help support you? Sometimes in these moments, it's hard for them to express it. Now, what do we do with paranoia and delusions? So we want to connect with the emotion of the delusion or paranoia, right? It must be frightening to believe you're being followed. Let them know that you understand why they would feel afraid, given the things that they're thinking, but we are not saying that we believe that this is happening. We're not saying we don't believe it either. We're just saying, you know what? We're in my mind, right? I'm not gonna validate this delusion because it isn't real, but this feeling is very real for them. So I can provide validation for that, right? Being so scared or being so worried must be exhausting, right? So we're letting them know that we can recognize the feeling. And then we're showing compassion, right? Compassion for how that feels. Even if it is this false belief, do what you can to help when the person is acutely unwell. For example, if they think that they're being listened to through electronics, maybe you turn them off. Right? So we're not agreeing that they're being listened to through the electronics, but since they're acutely unwell, we're kind of in a crisis situation, we're going to turn them off. And we're offering reassurance. Your loved one may think things are going on that really aren't happening, or they might feel worried about things that aren't real. And we can try to offer them comfort and help them feel a bit safer. We can let them know that we're not scared. Again, we're not trying to change their mind about something. We're not saying it's not happening. We can just say, you know what, I'm not hearing it and I'm not feeling scared. I feel safe and I can help you to feel safe as well. What do we do about the anger and aggression? So we want to remain in control of ourselves. When you find yourself on the receiving end of someone's anger, ask them to explain why they're angry and then listen to their answer. And be prepared to repeat yourself and be patient. But we don't want to put ourselves at risk. Right? If the things that you've tried haven't worked, if the situation is getting worse, you may need to leave, and that's okay. If you feel that there is a serious risk of violence, call the police for help. And so when do we want to get that emergency help? If someone is in danger of hurting themselves or others, we don't want to try to diffuse this situation by ourselves. So we can call 911, mobile crisis number if you have that in your local area, or whatever your local emergency number is. And we want to do this immediately. When appropriate, so if someone is not in immediate danger, we can use a hotline number, so a crisis number like 988 in the United States or Canada, or 1-800-273-TALK. Also, if you can do so safely, you can be the one that takes your loved one to the emergency room to be assessed. Now, here's some additional resources, support groups, recommended reading to take a look at. And we'll put links for all of this in that email we send out tomorrow, as well as in the chat for you. And here's our crisis resources. So we already listed a few today, but here are some more. So if you or someone you know are in crisis, these are numbers you can contact to get some advice, some support. And you can call on the behalf of someone else. Maybe your loved one is in crisis, they're not willing to call. You can call there and explain what's going on and get some advice of what to do next. And again, all of this will be in that email we send out tomorrow and in the chat for you. And then here's our upcoming webinars. Just a reminder, today is Wednesday. Wednesday's double feature day. So we'll be back here in about an hour to talk about understanding dissociative identity disorder. And then that's our last one for this week. No webinar tomorrow while Mindspring prepares for their golf outing, which we're really excited about. And then we'll be back here on Tuesday talking about communication do's and don'ts. So if you haven't registered for Understanding Dissociative Identity Disorder, which again used to be called Multiple Personality Disorder, go ahead and register for that. We'll put the link in the chat for you. And then we'll give you the link to register for all of these in that email we send out tomorrow and in the chat. Take a look at our upcoming webinars. And while you do that, I think I've got time for maybe one more question. So someone shared that they're the one who's struggling with a mental illness and they feel a family member distancing themselves. The family member is really struggling to watch this person having a difficult time. And so what can we do to kind of help this relationship? And so couples therapy could be really beneficial. Also, if you've got a therapist of your own, which hopefully you do, talking with a therapist about possibly bringing your family member in for a session so the family member can have a better understanding of how hard that you may be working towards trying to feel better. Now, if you need any additional resources, you can hop on over to our website, mindspringhealth.org, or you can find us on social media, Facebook, TikTok, and Instagram at Mindspring Info, or on LinkedIn at Mindspring Mental Health Alliance. You can also send us an email at info@mindspringhealth.org. All right, I think we've got maybe time for maybe one more question. So looking through these questions here. So what can we do if someone we care about is behaving in ways that kind of indicate to us there might be mental illness going on? They don't agree, and none of their behaviors really kind of are needing either hospitalization or the police involved. What can we do? Can we get a court order? So typically, a court's only going to order treatment for someone who's a danger to themselves or others. And so if this person isn't a danger to themselves or others, there's not a whole lot we can do. What we can do is show them support and try non-judgmental communication. We can share with them what we're concerned about and why. Also, sometimes people with a mental illness might be in denial, or they may be struggling to even see that there is a problem, but they may notice that there's something they wish was different. Maybe they wish they could live on their own, or have a job, or have a successful romantic relationship. And we start to focus on that goal and them learning how to get help for that. So going to treatment, talking with a therapist about being able to get a job, when in reality, the treatment is really for their mental illness and the symptoms of it. but they're agreeing to go simply so they can get help to reach the goal that they have. Now let's go over our frequently asked questions in case anyone missed it in the beginning. This has been recorded, and everyone who registered for today's webinar will receive an email tomorrow with a link to the recording in it. Also in that email will be all of the resources we talked about today. No slides will be sent out, and CEUs are not provided for community education webinars. Now, what we do provide are certificates of attendance once you have completed that post-webinar survey. So our goal is that everyone has left here feeling like they learned something, and this survey lets me know if we reach that goal. The organizations that support our webinars want to know how their donations are used and what communities participate. And this data is randomized, it's confidential, and no one's demographic information is shared. So everyone who registered for today's webinar and joined us during this live session will receive an email from certificates@mindspringhealth.org soon after the webinar ends. Complete the survey within 48 hours to receive your certificate. Now, even if you don't want a certificate of attendance, we'd love for you to complete the survey. Your participation helps us to continue to offer these free webinars. Thanks so much for joining me. We'll be back here in about an hour to talk about dissociative identity disorder. And it's not too late to register. So if you haven't registered yet, hop on over to our website and do so. I'll see you in an hour.